One of my favorite things about teaching cardiology is witnessing in real time the light bulb moments that happen when the dots are finally beginning to connect, and my patients, my students, my nurses, they finally have that, oh, moment. You can see it happening, and it's a beautiful thing for an educator. So that said, welcome to today's episode of Make It Make Sense Cardiology. We are going to talk about the differences between being in heart failure and having cardiomyopathy. And I can see the question marks popping over your head right now. You're probably wondering, well, isn't that the same thing? Heart failure and cardiomyopathy? It's not. It's not. Lock in. Let's explore. Heart failure, in its simplest definition, means that the heart is literally failing to do its most important job, which is twofold. Heart's got to be able to squeeze adequately enough so that it can provide the body with the blood flow that it deserves. And then two, the heart's got to be able to relax effectively so that it can get back what it gave out. It's a continuous cycle of give and take with the heart, or give and receive with the heart. That is the heart's job. Squeeze and relax. If the heart is not able to perform either one of those functions, then there will be symptoms that develop, meaning there's going to be fluid retention. You're going to have dependent peripheral edema. You are going to have shortness of breath. You are going to have orthopnea. You are going to have abdominal fullness. That's one that commonly gets overlooked when trying to qualify heart failure. You're going to have JVD, jugular venous distension. You may even have some altered mentation or feelings of fatigue. Take home point is that when the heart, if it is truly heart failure and the heart function has become compromised, then you're going to have symptoms as a result. That is called being in heart failure. Now, the culprit behind heart failure has got to be identified if you are going to give your patient's clinical presentation that diagnosis. The culprit of heart failure, or potential culprit of heart failure, is cardiomyopathy. What is cardiomyopathy? Look at the word by the sum of its parts. Cardio, meaning of or pertaining to the heart. Myo, meaning muscle. And then apathy, meaning disease. So by definition, cardiomyopathy means disease of the heart muscle. There are 5 different types of cardiomyopathy, my friends. The first one is dilated cardiomyopathy, which is the most commonly diagnosed type of cardiomyopathy. This occurs when the heart muscle, for a number of different reasons, the heart muscle becomes weakened and thinned over time. And when the heart is weakened and thinned, it's not able to squeeze. The squeeze of the heart is not very strong. Poor squeeze equals poor output. That is dilated cardiomyopathy. And just an FYI, on a later post, or posts plural, I'm going to do a more detailed explanation of each one of these, but for today, just get foundation and it'll make sense. So dilated cardiomyopathy is one. Second one, you've got restrictive cardiomyopathy. Remember, we said that the heart's got 2 jobs. It's got to be able to squeeze effectively, and it's got to be able to relax effectively. If the relaxation component of the heart is not up to snuff, then the heart is going to be stiff. The heart muscle, specifically the left ventricle, is going to be stiffened. With that stiffened cardiac muscle, that is what qualifies for restrictive cardiomyopathy, and the heart's pumping or relaxation capability of its pumping responsibility is going to be compromised. Third, you've got arrhythmogenic cardiomyopathy. Arrhythmogenic cardiomyopathy means that there's been some scarring, typically in the right ventricle, and when that happens, scarring and fatty deposit buildup. I wanted to get that in there. But when that happens, then that affects the nervous system, the nerves of the heart, which then affects the rhythm of the heart, and the heart ends up going into these abnormal rhythms. The abnormal rhythms will end up compromising how well the right ventricle moves, and then you end up with a degree of heart failure. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy occurs when there is a thickening of the left ventricle. The problem with hypertrophic cardiomyopathy is that when that left ventricle becomes thicker than what it's designed to be, then the actual reservoir that's inside the left ventricle becomes narrowed, becomes a little bit tighter. And so the heart's capacity to hold on to blood or to house blood in that left ventricle becomes compromised. So then when the heart ends up squeezing, an inadequate amount of blood goes into circulation because the vessel, the reservoir of the left ventricle is a whole lot narrower than normal. That's hypertrophic cardiomyopathy. And then finally, you've got Takotsubo's cardiomyopathy. We've all come to know this as stress-induced cardiomyopathy, and some people even refer to it as broken heart syndrome. All are acceptable terms. The crux with Takotsubo's cardiomyopathy is that there has been some traumatically stressful event, and it could be loss of a job, it could be loss of a loved one, financial disaster. There's something has stressed this person out to the point where there is a surge of hormones that overwhelm the heart and temporarily weaken the heart. Takotsubo's cardiomyopathy predominantly occurs in women, and that's not to say that it can't occur in men. It absolutely can, but the predominant prevalence is in women over age 40, believe it or not. Nonetheless, the diagnosis of Takotsubo's cardiomyopathy has to come by cardiac catheterization. You cannot just utilize an echocardiogram. You've got to do a cardiac catheterization to hang your hat on the diagnosis of Takotsubo's cardiomyopathy. That's a lot of information that I just gave y'all. But just know the take-home point is that heart failure and cardiomyopathy, those are not interchangeable terms. They are not. Heart failure means that you're seeing symptoms, and the symptoms that you are seeing need to be attributed to one of those cardiomyopathies. If you've got both pieces of that puzzle, then you can say that your patient has some form of heart failure. That's a lot. Take everything that I gave you, marinate on that. Rewatch this post if you need to a couple times to get greater depth of understanding. I appreciate all of your time. As always, thank you for giving me a moment of your day. I'm going to go inside and relax now. The end of my workday has come. I'm a little hungry and I need a nap. I'm stumbling over my words. But y'all have a great day. Thank you again for allowing me into your lives. I honestly appreciate each and every last one of y'all. And I'll talk to y'all next time, okay? Bye.